On this Wellness Wednesday, June is Brain Health Awareness Month. As women approach perimenopause and menopause, changes in hormone levels can directly affect memory, mood, clarity, and even long-term brain health. Dr. Patel joins me this morning with more on what you need to know about the connection between hormones and brain health. Good morning to you.
Hi, good morning. Thank you guys for having me.
So glad to have you back, especially because you always come with good tips, good advice, and good knowledge as well.
Try.
Tell me, why are hormone-related symptoms so often mistaken for mental health issues in women?
So I think it's really because there's so much overlap in the actual symptoms, right? So a lot of hormonal changes that we see manifest with symptoms like depressed mood, increased anxiety, sleep disturbances, brain fog, where our memory changes, decreased cognition. And there's a lot of overlap if you think of that symptom, this constellation of symptoms, with traditional depression, anxiety. And so I think if someone, if a clinician is just listening to the host of those symptoms, often if you're just kind of quickly trying to diagnose someone, it sounds like depression or anxiety.
Right.
But if you actually, that's why it's really important to sort of look at the root cause and look at the whole patient. Because often if you dig deeper, you will find, yes, these are manifestations, but they are manifestations of underlying hormonal changes. So if you can correct the hormonal imbalances, you're going to actually address a lot of these symptoms versus treating them with traditional antidepressants or anti-anxiety medications, which will solve some of the symptoms, but you're not really going to get to the root cause.
Also, what I'm hearing you say is the fact that, I think for patients, in the fact that you also have to pick a really good doctor who is going to listen to you, and you have to know how to advocate for yourself. So when someone's telling you and they're not taking enough time to properly diagnose you, you have to say, listen, this is what I'm going through, and I really need you to dig a little bit deeper. So making sure that you have a provider that takes care and listens to you. I think that's so huge.
It's important to advocate for ourselves sometimes, right? Sometimes it's okay to say, hey, listen, like I know maybe we're not seeing something obvious that's showing up on traditional labs or, the basic testing, but something feels off. And so when that's the case, advocate for yourself.
You have to have the ability to say that. Now tell me, how does estrogen and progesterone impact the brain?
So our hormones are actually really closely tied to our brain function. So if, specifically estrogen, progesterone, even testosterone really impact how our brain operates, right? So estrogen specifically increases serotonin levels in the brain. It increases blood flow in the brain. So a lot of that really affects our cognitive output, right? And really what we function like. And so when hormones are well balanced, a lot of those things run smoothly. But when we have disruptions in hormones, which is kind of what is perimenopause, or menopause, when we just have declines in those hormones and we suddenly lose them, then that's when we start to see a lot of those symptoms that we don't love.
Exactly.
The memory changes, the depressed mood.
The brain fog.
The brain fog, just not feeling like ourselves.
Exactly. And I also think in that space of time, you're going through perimenopause and menopause for the first time. It's not like you've been through it before, so you're going through these changes and you're wondering, how did I get here, and it can be a little scary.
And I think a lot of times, a lot of these symptoms happen in our 40s and early 50s, sometimes even our late 30s. For many women, that also happens to be a period of time where they're dealing with kids, getting older. Many have busy careers. It's just a busy phase of life.
It is.
And so I think a lot of women kind of put themselves on the back burner and they attribute it to, I'm just tired. I'm not sleeping well. I'm just doing too many things. Probably none of that is helping, but there may also be some underlying chemical imbalances that are happening that are making it all worse.
Exactly. So there is an explanation. You just got to dig for it a little bit, or pay attention to yourself as well, right? So tell me, what should women in their 30s, 40s, 50s know about these changes?
So I really think it's, don't assume and just chalk it up to, I'm just getting older, I'm just tired, I'm just busy. My kids wake me up 4 times a night, right? The typical things that we often attribute it to. I think if you know that there's a change, that you're not feeling as good as you once did, look a little deeper, right? Find someone that's willing to work with you to sort of look at your whole, your overall wellness. And it's not just about lab testing. That's one facet, right, of overall wellness, but also someone that's paying attention to diet, lifestyle, sleep patterns, what your stress level looks like. Someone that's really looking at the whole picture.
All of it comes into play, especially as we age and we start having to pay attention to more and more. You just mentioned the doctor, and we also talked about advocating for yourself. Anything women should directly ask to make sure that they get the support that they need?
So I really think it's just about communicating, right? So communicating the symptoms. So step one is really before you go see the doctor or the clinician, whoever. Oftentimes, we go in and we're sort of just wanting someone to fix the problem. But I think step one is really taking stock that's your homework, right? Taking stock of where
Do
you're
your homework
at,
first, do
right?
your research,
so really
and then
sort of
come.
pay attention to your own body and
Got
say,
it.
okay, these are my issues. Make a list of your symptoms, right? So then
So you
when you
don't
go
forget.
in, you're clear. You don't forget
Very
things. You
good.
cover everything.
Nice.
And then I think someone who's really paying attention to everything.
Yes, indeed. Okay, so make sure we're doing our homework, our research, and go in there prepared and ready to go and knowing what to ask for. Thank you so much for being here and sharing with us.
Such a pleasure.